Okay, so we're going to go through the different steps of the traditional approach. Okay, can you tell me what the F sound is?
F, 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 f.
Good job. Let's try that again.
F, f.
Good job. Okay, can you say this word?
F, e.
Okay, now let's say it all together.
Fee,
Okay, can you repeat that for me 2 times?
fee, fee.
There we go. All right, now what is this word?
Foo,
Good job. Let's say that again.
foo.
Awesome. Now what is this?
Fa,
Awesome. Let's say that again.
fa.
Great. Can you say this word?
Fud,
Awesome. What about this one?
fip.
Okay, now we're going to move into the little bit bigger words. A little bit of bigger words. Can you tell me what this word is?
Football,
Okay, let's try that F again.
football.
There you go. All right, can you tell me what this word is?
Farm,
Let's try that one more time.
and
There we go. Now what's this word?
fog.
Awesome. What is this word?
Friday,
Let's try that one more time. Can you give me a good F first?
Ide,
There we go. And what's this?
fork,
Awesome. Last word.
pops.
Awesome. Whenever we play football, we kick the football. What are we doing?
Kick the football.
Good job. So when we sit at the dinner table and someone asks to pass the food, what are we doing?
Pass the food.
Good job. So today we're going to have fun. What are we going to do?
We will have fun.
Awesome. In this picture.
I see a flower with 5 footballs and a butterfly.
Can you tell me what color the flower is?
The flower is blue and it has yellow petals.
Awesome. And what about, what's this again?
It's a butterfly.
And what color is it?
It's yellow.
And what is this again?
A football.
What do you do with the football?
You throw the football.
And
Kick.
what does the butterfly do?
Butterfly flies.
Awesome.
The traditional or motor-based approach was formulated in the early 1900s. It's referred to as the Van Riper method. Charles Van Riper used these techniques and made a plan for treating articulation disorders and published them. The steps of the approach include isolation, which is isolating the sound, nonsense syllables, which are suggested sequences of CV, VC, VCV, or CVC. The next step is words, which provide sounds in meaningful units using monosyllabic words. Phrases, which are 2 to 4 word phrases that include only one word that contains the target sound. Sentences, which are short, simple sentences with one instance of the target sound. And conversation, which is saying the sound correctly off guard. Treatment is viewed as a continuum and has 3 stages, which are establishment, facilitation of generalization, and maintenance. The first stage, which is establishment, is to elicit behaviors from a client and then stabilize such behaviors at a voluntary level. For motor-based approaches, this generally involves teaching the correct production of an individual sound. The second stage is facilitation of generalization, which is designed to facilitate or transfer or carry over of behavior at several generalization levels, such as potential, contextual, linguistic unit, sound, and situational. The treatment process includes instructional activities designed to facilitate generalization or carryover of sound correct productions to sound contrast words in speaking situations. The last stage is the maintenance stage, which is designed to stabilize and facilitate retention of these behaviors acquired during the establishment and generalization stages.
Motor learning principles are the selection of a target speech sound or sounds with instructions proceeding through the treatment continuum described previously until the target sounds are used appropriately in spontaneous conversations. Speech production is viewed as a learning motor skill with remediation requiring repetitive practice at complex motor and linguistic skills. There's pre-practice goals, principles of practice, and principles of feedback. Pre-practice goals, which the clinician must consider motivating the child with a goal to work on. The principles of practice is the practice is key variable for mastery of any skilled motor behavior. Principles of feedback, the less feedback is better than more because it gives the child the opportunity to reflect internally on his or her productions.
Van Riper's phonetic placement approach falls within the traditional approach. Phonetic placement is the most popular method of correcting speech sounds in young children. The clinician demonstrates to the child how to correctly place their tongue, teeth, and lips, which are their articulators, in order to produce the correct speech sound. Some pros for the traditional approach is that they include perceptual tasks, they isolate sounds, and they have a step-by-step process that can make it more clear to understand. The cons are that it's more drawn out, and not one strategy works for every child. You can't tweak the process in such a formulated area. It's also not good for clients with multiple errors.